Okay, in this video I'm going to go over the anatomy of the tooth with the emphasis on things that are important to know. Okay, this is not like school anatomy where they'll just make you memorize stuff. I'm going to tell you what matters in learning about a tooth. I've been kind of curious about teeth. I had a little problem with my own tooth because, you know, I thought I would try that sugar diet, man. It just caused me problems. I activated an old cavity on a tooth and it's a pain in the butt. I have some pain in my tooth. So let's go through what happens. The key thing you need to know is that these are the root of the tooth, and the root are sort of planted in the soil, if you will, of the bone. The mandible is your jawbone. The upper bone is called the maxilla. And the tooth is connected by this pink stuff called the periodontal ligament. This drawing right here is the least labeled one. I'm going to show you progressively more and more labeled drawings to go through more anatomy, but this is just to get the general idea. And the most important thing in this picture is to see that the blood vessel comes in through the bottom of the tooth. You need to know that. The blood vessel comes in through the bottom of the tooth, and that gives life to the tooth. It needs that blood supply to stay alive. The next thing is the nerve comes in through the bottom of the tooth. All right, so here's the enamel, the white stuff you see when you look in the mirror. Inside of the tooth is the dentine. You need to know that, dentin. And then deep to that is the pulp with the blood vessels and the nerves. The pulp canal is called the root canal. So it's a canal for the arteries and veins and nerves in the root of the tooth. Okay? This is very important. We're going to learn in a moment that there's little tubules extending through the dentine, and bacteria can get inside of them, and the bacteria can then spread down through the tooth root if the person's had a root canal. That's why root canals are a bad idea. Now, some other things to know about the tooth is that let me show you the next picture as it gets more detailed. This will be called the apex. Okay, this picture has a little bit more detail that this is the tooth apex. And you're going to need to know that that term's going to come up a lot. Jawbone, again, on the bottom is the mandible. Up above is going to be called the maxilla. Now, here's an important word to know, the periodontal ligament. The periodontal ligament is collagen fibers growing outward from the tooth and growing inward from the jawbone. And they connect and they form a locking mesh. And the relevance is when you have a tooth removed, a tooth extracted, you have to remove the periodontal ligament or it will not heal correctly. Most dentists do not know that. Now, the other thing that happens, see, the average public tends to very much trust the doctor, trust the dentist, and what they don't realize is medical doctors in the United States and dentists in the United States are very poorly trained. They are not well educated. They don't know their own little field. All a dentist has to do is learn the tooth, and they don't know it. There are exceptions to that. The best dentists are members of a society called the IAOMT, the International Academy of Oral and Medical Toxicology, okay? They know a lot more about teeth than a regular dentist does. Regular dentist is kind of like a carpenter who doesn't know what he's doing, okay? All right, so anyways, you have to know about the periodontal ligament because if you're going to have a tooth removed, a root canal surgery removed, they have to also take out the periodontal ligament. If they don't take out the periodontal ligament, the patients often have bad outcomes. Okay, that's a recurrent theme. I just read like 4 books on dentistry. I'm real interested in the subject, and this comes up over and over again. You must remove the periodontal ligament in order to have sort of fresh, live bone that can grow back into the socket, okay, and for it to heal in a healthy way. And the danger of the apex is not only when they do a root canal, they remove all this stuff in here, the arteries and nerves, the pulp, but sometimes toxic chemicals leak out through the root apex. Okay, I'm going to come to the dental tubules. That's going to be like a real big point of this lecture here. This is something you want to remember the rest of your life. Remember how I talked about the arterial blood flow comes in through the root, and then it exerts a fluid pressure that pushes fluid outward through the dentine tubules. So these dentine tubules, from the pulp space here, fluid is pushed outward through them. That's called the hydrodynamic theory of tooth function, and it's very important. By pushing fluid out from the center of the tooth, it also pushes bacteria out. This prevents cavities. This keeps the tooth healthy. As a person gets older, they get atherosclerosis, narrowing of the external carotid artery branches that supply the face, and that lack of blood flow to the tooth decreases the blood flow to the pulp space, decreases the pressure pushing the fluid out of the tooth, and it increases the risk of getting cavities. So atherosclerosis increases the risk of cavities. Also, psychological stress, caffeine are going to vasoconstrict those arteries. They're going to decrease that outward flow of fluid through the dentine tubules and increase the risk of cavities. That's all bad. And I had the experience where I reviewed 1,000 cases in a row of cognitive decline, dementia, memory loss, and what I saw almost, this is a little bit vulgar, but it reminds me of the Dice Clay had a quote. He said, 2 tits, a hole, and a heartbeat, and I'm there. Okay, excuse me, I know that's very rude, but what I'm trying to tell you is when I look at a head CT, if I see that 2 cataract surgeries and no teeth, edentulous, you're showing me a demented brain. Almost always when I see that, the patient's demented, okay? That is the most common pattern I see on a demented brain is 1 or 2 cataract surgeries, often both of them, an atrophic shrunken brain, and no teeth. That's the most common thing I ever see on a dementia CT scan of the brain. Okay, I sometimes see, cortical convexity, infarct-related dementia. I sometimes see quite a lot of periventricular ischemic changes, flare hyperintensities, and all that kind of stuff. Deep white matter, strokes. But that's not what I most often see. I most often see a shrunken brain, 1 or 2 cataract surgeries, more often 2 than 1, and I see no teeth, edentulous. All right, so that's the reason for this lecture today, to make this point about the fluid coming in, hydrodynamic theory, and then pushing fluid outward through the dentine tubules, and that helping to prevent infections. So, and what you don't want to do, of course, is eat sweets, especially drinking these juices. You pour these fruit juices over your teeth. That's how I reactivated a cavity that I had under control for many, many years. Soda pop is real bad. Orange juice is perhaps the worst. It's extremely acidic. Just eating really sweet things is bad. Soda pop's not only acidic, it's also sticky. So you want to avoid all that stuff. And Weston Price was a dentist who traveled all over the world, and he saw all these traditional populations eating, primarily plant-based diets. Some of them eating a lot of meat too. They didn't have any problems with cavities. But once they started eating jam and white bread, made from flour and other flour goods and sweets, tons of cavities. So anyways, that's introduction to dental anatomy. I hope you found it helpful.